Jean. So I wanted to move on and kind of talk about some of these things that we've already started talking about. And Donna had a good question right off the bat. Just for my education, is there anyone on the meeting today that has reopened any of their dining centers? And if so, would you be willing to talk a little bit about what that process looked like, how the decisions were made, what sort of procedures you've put in place for things like meal service, but also registration or assessments, that sort of thing, and also just kind of the things that you might be seeing right off the bat. And maybe if you just opened, you haven't seen a lot, but the things you're hearing from customers, observations on the level of participation, customers' comfort level. Would anyone like to share?
Sarah, before they share, there's one question in chat still about Jim's PowerPoint. Wondering if they can use Jim's PowerPoint to help train others.
I will check with him to be sure, but I'm pretty sure if he's willing to share it, that you can use that information however you need to. So I can check to be sure. Oh, there you are, Jim.
Yep, it's all state property, so have at it.
Okay, great. Thank you. I didn't know you were still here. Thanks. All right, so reopening. Has anyone opened their dining centers for dine-in service? Anyone on this meeting?
Sarah.
Hi, Shar.
Hi. So we haven't opened our sites, but we have 2 restaurant locations. So we have a site in Beagles, it's at Beagles Bar and Grill, and one at Bernie's Wagon Wheel. And the restaurants are open. So we're continuing to allow takeout from those sites. But Bernie has had 2 regular diners that have come in and have asked why they can't stay and eat in the restaurant when the restaurant's open. So what I have told Bernie and Dan to do is, if a diner comes in for the purpose of getting their meal as a takeout meal, and they ask if they can eat there, then as long as they can ensure safe distancing, we're not going to turn them away because they are open, and I feel like it's just good customer service. So I have told them to honor that request, but that we're not going to offer to allow people to eat there, and we're not going to advertise that if you want to, you can ask to. So it's kind of, if they ask, if they make that attempt, we'll honor it, but otherwise we're just going to do it as a carryout.
Okay.
And I told them that if they do have a diner who asks and does stay and eat there, that they do need to record it as a congregate meal, because it would then be a congregate meal, so they do need to record it appropriately.
Okay. In that type of a situation, though, you probably wouldn't have a site manager, so who's doing that reporting?
Those restaurants, how we do it is we contract with the restaurant. We actually have restaurant staff that are contracted for 4 hours a day to do the site manager stuff. So they're contracted with our program. So they employ the staff person to be the site manager. So the site manager is already there to do the home delivered meals. Does that make sense? The restaurant employs the site manager under contract with us.
Okay. Anyone else in a restaurant type situation?
Looks like Ashley from Columbia is saying that our congregate sites remain closed at this time.
We have a restaurant location that has requested, that is open now, that is requesting whether or not we would like to return 2 days a week as we were before. And we have told them no, and they were not one of our restaurants that are doing carry out. They were simply one of our senior dining sites. So we told them no until we know that it's safe and people can social distance and our staff can be there. And so we're not looking at reopening that until probably September at this point.
Thanks, Angela. Shar, just another question as I'm thinking about this. And just out of curiosity, I'm just wondering, has your corporation counsel said anything about that, like potentially being a liability? Because I've heard from other programs that that's been a concern. I was wondering if that was a concern of theirs.
I didn't talk to about people eating there.
Yeah.
I didn't talk to my corporation counsel about it. I talked to my public health officer.
Okay.
And she said that she doesn't support reopening our congregate sites right now, but that she understands that this is kind of a unique situation in that the restaurants are open and are serving customers. So they can't tell somebody that they can't eat there, because technically they could take their meal and sit down at a table and eat it.
Right.
So to avoid it, to be fair in that situation, to make sure that we're not advertising that our sites are open and that we're not offering to allow people to eat there, but that if they're the ones who are asking, then we make sure that we're being supported, that we're being fair with the restaurant requirement or the restaurant policies.
Mm-hmm. Yeah, I would think that it would be very difficult to tell someone that they had to leave if they wanted to just sit at a table when the restaurant is open. But yeah, I was just curious.
It's a very tricky situation. So what we we're when people ask, because we've had a lot of our diners ask, when is the site going to be reopened? And we just tell them that even though the restaurant is open, that the dining program is separate from, it's like a function that is carried out there, and that we don't have that we haven't started to look into a date that we're going to open, that it's something that we're just watching, and that as we feel we're at a point where we can open it, that we'll release that information.
Mm-hmm.
So we've had to be kind of really careful on how we're providing services from those two locations.
Sure. Understandable. On a recent call within our, well, actually, I think it was an ADRC Aging Forum call. Our Deputy Division Administrator Chuck Warzeko was on the call, and he said something that I thought was kind of interesting, like from the perspective of our services. Of course, he advised following up with your public health department to find out, what phase you're in, if your county or tribe is doing phases. But to be on the safe side, if your county or tribe is saying that you're in phase 2, to operate as if you are in phase 1, to kind of walk it back because of the population that we're serving. So I thought that was kind of an interesting way to think of it and make sense of, and maybe rationalize to the public why the decisions are being made that are being made because of the participants that we're serving. Is there anyone else on the call? Oh, sorry, go ahead, Angela. Were you going to say something?
I was just going to ask, since nobody's come forth yet to say that they are open, I would be curious as to, you know, in the more populated areas like Dane, Milwaukee, Brown County, Rock, when are they thinking the possibility might be for them to open? I know in Dane, it's mid-August to September, but that was before we kept increasing our COVID cases this past week or two. So I was just curious kind of where other people are sensing that if the rate of increase slows down and we are flattening again and we move through phases, is there kind of an anticipation of when?
Hey, Angela, it's Galen
Yeah.
from Milwaukee County. Obviously with, you know, the Hispanic and African American communities being, you know, hit the hardest right now, and that's where, you know, that's a large percentage of our demographics here in Milwaukee County, we are being extraordinarily cautious. I'm not even putting a date out there to any of our sites as to when we're thinking of opening. I mean, truthfully, I'm going to say I don't think our senior centers, especially with, you know, since we don't really know what's going on, you know, how this virus is going to, well, we have a second wave in October. Is it like the flu where you can get it over and over again? Is it like SARS where you get it once? So our senior centers may not even open until Q2 of next year. But we are taking it, you know, Milwaukee County is really taking it from the perspective of, you know, restaurants, you know, they're opening up, and that's each person's individual decision, you know, to make, whether they're going to go to a restaurant, whether they're going to follow social distancing, wear masks. But when we open up, it is because the Milwaukee County feels it's safe to do so. And so, you know, our county board, you know, our participants, when I tell them that, they're all very much understanding in that we care about your safety, your health and well-being. So I don't anticipate opening up this year, to be honest.
Thanks for that input. Like I said, I just wanted to see where everybody was standing, because we tend to inch a little bit towards it and then we step back. Our senior centers are probably a little bit more showing a willingness to open for very specific services, by appointments, very small group, often not congregate meals yet, although some are large enough to do all the self-distancing if they should choose to go in that direction, but they're not yet either. I just was trying to get a sense of where others are at in their thinking, so I appreciate it.
Yep, and that's our, you know, that's where we stand. Every county is different, but my big thing that I tell participants is, you know, you can't come in and eat a meal and wear a mask.
Right.
Is number one. And number two, if we can only have 25% of the normal amount of people, and I'm going to be very candid in this call right now, is, you know, I have a very diverse, one of my sites is very diverse, it's Elks Lodge, but if I can only have 25% of the people come in and I have to have a lottery, and, you know, it's one ethnic group that happens to win the lottery that goes in that day, I can't, obviously you can understand that in Milwaukee County, we're a very segregated city here. And so I really can't have those kind of concerns. I don't want to project any kind of preference or anything like that. So,
Right, it makes it extremely difficult to determine then how you're going to prioritize, right? When you have to keep it to that low of a percentage capacity.
oh,
So,
right.
yeah. So I guess I wonder if anyone's thought about that, about how, if they should open at a reduced capacity, how they might address prioritizing people. Would it be just first come, first serve reservations? Or has anyone thought about those procedures or targeting more at-risk participants? These are some questions that have come up at the national level too.
We thought about doing multiple dining times.
Mhm.
You don't have to choose between who gets it and who doesn't. We've thought about dining in shifts, but then that adds a layer of sanitizing in between and maintaining food temps for longer periods of time. So, we haven't actually done it yet, but that is one of the potential solutions we're looking at, to make it as open for anyone who wants to dine as we possibly can, and not have to make decisions about who doesn't get to eat today.
Mhm. What about some of the other more populous counties, as Angela was wondering? Brown or Racine, Waukesha, hi Mike, or
How's it
Kenosha?
going? Yeah, we're not anywhere near being ready to make a decision on when we're going to open again. They powers that be are telling us probably not before the end of the year. So I think the latest we're hearing is once there's a decent vaccine, then we'll consider it. But for now, I would be surprised if it happens this year yet. But what we're going to do is we're going to work on trying to get more hot meals to people and focus on delivery instead of congregate. It's been put like a hard stop, put on hold.
Thanks. Hi, Elizabeth.
Hello. I agree with Mike. I mean, that's pretty much where we're sitting over here in Racine as well. We've been talking about carryouts as a possibility, but as for the sites open for dine-in, it would likely not be until next year.
And we talked about carryouts, having people come to the sites and pick it up, but the idea is, why not, if we can continue to deliver to people, why not just deliver it to them? So we're still doing that. We've got the capacity to do that, and we got the capacity to do more.
Sarah, there's a couple chat comments. Pam Weber in Monroe, we have one meal site at a senior center run by the city it is in. The senior center has reopened, but the meal site is not open, so this has been challenging. And then also La Crosse County does not have any plans to reopen anytime soon.
Yes, sorry, La Crosse, you're another populous county that I didn't mention. Thank you.
This is Kimberly and Brown, and we're on the same page as Mike was saying. I don't anticipate our board will allow us to do a congregate meal until there's a vaccine or other significant mitigating factors. So we aren't even having conversations about reopening for congregate. So probably 2021 at the earliest. And then, yeah, we're just trying to figure out how we can continue to offer more homebound meals and then go above. Typically, we are a 5-day-a-week for homebound meals, but trying to offer more for our weekend meals for our most food insecure. So
I really appreciate the conversation, because here in Dane, I'm pleasantly surprised at how people are not thinking about bringing congregate back until the new year or until there's a vaccine. That has not been the push here, quite frankly. It has been very close communication and working with our public health as to something that we would consider doing with significant social distancing, sanitizing, multiple shifts, things like that, once we hit phase 4 of our bounce back plan. Now, remember, we're in 2 and we're not doing very well. So it could potentially be till January of next year, but that's not, I guess we've been thinking more about opening versus not opening, and what would it look like and when and how and those kind of things. So this has been eye-opening to me. I have to say, it's just been a different direction here. There's been no authority come down and say, don't do it. It's been work with public health and do what you can as cautiously and as thoughtfully as possible. I also have to say, though, here in Dane County, more than any place I've ever lived in my entire life, and I've lived many, they are all about the right to self-determination, and allowing people, just because of their age, it isn't a magic 60 and over is, you know, just because of age, allowing them to self-determine. That, having said that, however, we're also not going to risk liability and open a restaurant site when it's not a good thing to do right now, or open a congregate site when the time is not right or ready. We're not going to encourage them to self-determine when it's blatantly not safe, but at some point, you know, this is a real struggle in terms of decision-making, I have to say, when there isn't somebody up above on your board going, don't do it ever, you know, or don't do it till there's a vaccine, or don't do it till the, you know, I don't know how much more we're doing everything we possibly can to get food to seniors as it exists now. I had shared with Sarah, we've done over 6,400 carry-out meals last month alone. That's just people driving by and we're putting it in the back seat from our restaurants. And that's not even with all of them open yet that way. So then the volume, the sheer volume of what we are doing with regards to feeding people, we did the math, and in April of last year, between home delivered and congregate meals, or May, sorry, we did a total of 20,000 for this county. In May of this year, just home delivered and carry out was 30,000, over 30,000. So we don't have the capacity like you might, unfortunately, to deliver more meals. We're at capacity with regards to home delivered meals and volunteers and our caterers. But we seem to be doing a lot of carryouts, and I just, you know, I don't know. It was surprising to me to hear the difference between some of the, you know, the majority of the counties that are saying, we're not going forward with congregate. We're not planning for it because we're not going to do it, you know, pretty much because it's not safe. Yet then our county is looking at what can we do to do it. So it's a real dilemma in thinking from our perspective.
What was interesting too, Angela, is that on the northern call last week, I expected to have a completely different conversation than what we're having here. And no one had opened up there either, which was surprising to me, given that the volume of cases is much different than in this area for all of you. So it is interesting. But I think that there's this dilemma that maybe you're experiencing in Dane is, what is the lesser of two evils here? as far as the safety of participants coming to dine in versus the lack of socialization that's occurring right now. And I know the senior centers are really struggling with that. And in reference to Pam's comment from Monroe, I have been very surprised by attending some of the senior center calls that the number of senior centers that have opened because of their concerns about social isolation. So it's really interesting to see kind of the differences between these two services serving the same people.
Sarah, there's a question in the chat. Oh, sorry, Angela.
Pam Weber had put a comment into the chat that I wanted to pursue. And she had said that the senior center is reopened, but the meal site is not open, and this has been challenging. I would just be curious, in what way has it been challenging, Pam Weber?
So it's been challenging for the customers, right? They want to be there to eat their meal, and they're coming to carry out their meal, or they're there in the morning and they get their meal and they go home to eat it and then come back, or something. You know, I'm not sure what they're doing. If they're not going home and they're just holding on to it, you know, just that challenge of wanting to sit and eat with their friends.
Mm.
Socialize, the congregate piece, right?
Yeah.
There's also a question in the chat room. Well, it's actually a comment. Hold on here. From Morgan. Agreeing, does anyone have a congregate sites held at housing facilities that is open? We have 2 breakfast programs that are held at different senior apartment complexes, and the apartment staff has discussed the possibility of having us come back to provide the meal. Kim Losi chimes in and says, we have one in a housing facility, but they won't even let us in. Another one we operate for home delivered meals, but the residents do not want to eat or get together at all. And to add to that, Davin, these are the people who are on the phone that can't see the chat room. Davin in Kenosha is saying we have a housing facility that is open. We have home delivered meal trays delivered daily. Residents can pick up their trays and bring them back to their apartment. Our site manager also delivers some of the meals directly to participants' apartments if needed.
Yeah, I run into that problem in Winnebago County. We have, you know, the housing authority, which has everything shut down. We have senior housing where they won't even let us in. Another senior housing where they're open except for our dining room is not open. And the senior centers aren't open yet, but they keep on asking us, when are we gonna open, like, so that they can open. So when we do, if whatever it looks like, I feel like different sites are gonna open at different times. They would like to anyhow. I'm not saying that's what we would do, but it really looks like some would open right now if they could, and some would probably never open. I don't know. So it's going to be complicated. It's not going to be easy because everybody wants different things. I mean, everybody wants to be safe, but people's definition of safe are different. So.
And I think there's different levels of safety. So here in a housing facility, it's sounding like there might be some that are open, but maybe not open to the public. And feel free to clarify, anyone who was making a comment. It would be my recommendation that we not open our housing facilities to the public, because these are people's homes, and to introduce people from the community to those facilities, I think could be a much higher risk, because these are surfaces that these people are touching every day. I mean, they live there, so and air they're breathing every day. And so I'm curious.
We have one facility in elderly housing, and that has stayed open the entire time, the Romness Apartments. However, the Public Housing Authority does not allow others to come in from outside of that building to dine, and nor do we have congregate dining in our dining room there. We simply prepare the meals in the kitchen. They come down for carry out, or we deliver the home delivered meal to the various apartments. But yeah, no one's allowed in from the outside. And they even insist that we have the same staff delivering each day. It's the same site manager, so that there's not different people coming in and out.
Right. And we have some sites that are in nursing homes, you know, in dining areas and nursing homes. So I think there is going to be a lot of variability in the level of risk of opening some of these locations. And it may be that some will open before others because of that, but it is challenging.
Couple comments in chat. Don Jorsted from La Crosse. La Crosse has a site in a senior apartment. We have transferred everyone to Homebound to provide the meal to participants. Kim Losi, ADRC of the Lakeshore. I have sites that won't even allow my drivers to come in. We have to bring them to the parking lot. Davin from Kenosha. We have not advertised our housing facility site as open to the public, but have accommodated those that live there.
So I think related to this conversation, something that we need to be thinking about is that there's a very strong possibility that even if our locations open up this year or even in January, because who knows what's going to happen, we have to have some plans in place to close again if that need should arise. So that's something that we should be thinking about, but luckily you've all had to do it within like a 24-hour period already, so.
Well, something else that occurred to us is this is a, you know, if there's a silver lining to COVID in any way, this is a wonderful opportunity, perhaps to close some sites that should have been closed a long time ago because of access, because of poor attendance, because of nobody cares to eat that, you know, whatever, and reopen them in different spaces, different geographies, different, you know, so it is an opportunity, whereas you would have had, you know, political fallout all over the place if you just up and shut one of these down some places, that because it's been closed and continues to be closed, that, you know, moving the location to a site that is better able to accommodate, whether it be social distancing, more people, and bringing those people from those closed sites along in this process because of COVID, that it may be an opportunity for some. You know, I don't know that we have any here, but it presents a opportune time to perhaps make some decisions that were not easily made prior to now.
I agree, Angela, because like I was thinking too about contracts going forward. We do a yearly contract with many places. There really is a time to think about, are we going to renew this contract, you know, and pay somebody when hardly anybody eats there anyhow, like you said. So it is time. It's just been a time, as busy as it's been. I believe that our shortcomings in our programs kind of like are glaring. If you don't, you know, like food safety, if they were following their food safety all along, they should have been doing that. We should have been safe. But, you know, you had to go over some rules again. So it's been a good learning experience, even though it did seem like it was slammed onto us awfully quickly.
Well, and I can tell you honestly, you know, I've always been a proponent for the My Meal, My Way in restaurants, not for all sites. Don't ever quote me as saying all congregate sites should close, because we've got some great ones that are very well attended here that are not in restaurants. But one advantage to having those relationships in those locations geographically with those restaurants is we could scale up to doing 6,000 carry-out meals very quickly. People already knew the location, they knew the menu, they knew the food, they knew the owners, they knew that our staff would be there to make sure that it was contactless, somebody they trusted. So, you know, I can't, it is beyond me knowing how complicated and how many sites we have here in Dane County, how easy it was to feed people during COVID and transition very quickly. So, you know, I just put that out there as a lesson learned. We were in a much better position to be able to do that.
Elizabeth, not to put you on the spot, but did you want to talk about what you're
I knew
doing?
it was coming. Yeah, this idea got off the ground really, really fast, much faster than I would have liked. It was a huge challenge to put together, but Racine County is partnered right now with 14 restaurants across the county, which we've never done anything with restaurants before now that I'm aware of anyways. And we are having those restaurants prepare and deliver the food. We are serving approximately 500 people a day. Anyone who was Meals on Wheels, pre-COVID Meals on Wheels, got ported over to this restaurant model. Anyone who is congregate and was interested was the same. We've had, I would say, approximately 100 people who had not been with our program ever before sign up for this program as well.
Can I just ask? So how were you doing home delivered meals before pre-COVID?
Volunteer and a catering company.
Okay, so you got rid of the catering company?
We had done shelf-stable meals that we had gotten from Hoffman House, and some frozen for like emergency type purposes. We've been in contact with them on and off just to make sure that they're ready to go if we decide to go back with them in any capacity. But for right now, we are not utilizing our catering company.
And your restaurants are using their own staff to do delivery to residences, kind of like a Grubhub or a Uber Eats or interesting.
Yeah, so we still use Serve Tracker to manage all of our intakes, and our intake process really isn't that different. Instead of using Serve Tracker for route sheets and things like that, we are using Excel. It's a lot more manual than it used to be, which is okay. After this, I'm probably never going to want to see Excel again, but that's fine.
With 14 different restaurants and 14 different delivery vehicles, then basically, if somebody's not home, have you crossed that path yet?
Yes, so we are leaving the meals. The restaurant lets us know if we're doing contactless delivery. So much like someone else had said, you know, they'll put the bag on the door or on the chair next to the door, what have you. They'll knock and ring the bell and they'll back away. They'll wait to see if someone comes to the door. If they do, they'll let us know that, yes, they saw that person that day. If they don't, they let us know that. And then our staff calls that person. If we get a hold of them, hey, your lunch, did you get your lunch today? Yep, I got it. I was just a little slow getting to the door. If not, we continue to try to call them. We call those emergency contacts and make some kind of contact that day.
A couple questions from the chat room, Elizabeth, if that's okay. How do the expenses compare? Higher, lower, about the same?
Higher, definitely higher.
Donna Richards and Adams, wow, we have a hard time getting one restaurant to pass a health inspection.
Oh boy. Not going to Adams County to eat. At a restaurant.
I can't speak to any of that part of it. I'm more boots on the ground with it. This idea, it had come up beginning of April. We started delivering meals that way mid-May. So that side of things and how the contracting all worked, that is above me. That's more fiscal department and everything else. So.
Thank you for sharing that.
Absolutely. It's been a huge challenge, like I said, but it's been really good. We get really good feedback from the restaurants. Most of them really enjoy what they're doing too, which is awesome. With any participants, you know, even when we were with our caterer, it was always, complaints about too much fruit cocktail and complaints about your vegetables are too cooked or not cooked enough. I mean, we still get those issues that come up, but for the most part, it's been really good.
What a great way to help 14 different restaurants survive.
Mm-hmm.
Business perspective. I mean, that's one good feeling we have about using 5 or 6, but that, I think I give you kudos there for it being a win-win for both.
Thank you. I will pass that along because it sure wasn't my idea, but it's been good. I'm seeing a question that did pop up, keeping this model or just through COVID-19. Right now it's just through COVID. There have been some extremely preliminary talks about going for, like I had mentioned, the carry out for the congregate folks instead of the delivery. I don't have any kind of start date that we might be back to our regular pre-COVID Meals on Wheels delivery. I think it would be awesome to partner with some of these restaurants on an ongoing basis once we are back to normal, maybe like a once a week guest restaurant in the area kind of thing. How that would look yet, I have no idea, but I'm hoping that the partnerships continue in some aspect.
Elizabeth, I don't know if you said this, but are you collecting, I mean, I know it's really busy and a lot of work to do this, but have you collected or are you going to collect any sort of satisfaction data, like surveying participants that you could maybe then compare against Hoffman House and pre-COVID to kind of guide those decisions?
Yeah, we are going to. Because I came to the nutrition program in the middle of 2019, I'm not sure where that 2019 survey originated, but if it's okay, I'd like to adapt that survey and just throw some of that restaurant model wording in there and send that out to folks. And that's how we would get that information.
Yeah, definitely.
Okay.
Yeah, just a reminder to everyone that we're not doing the formal surveys like we've done in past years this year just because of everything that's going on, but you're certainly encouraged to use that template or create your own to try and utilize that for this type of a thing to see if there might be some programmatic changes that you might make and sustain.
There's a question here about, Elizabeth, are the restaurants meeting, or opening this up to everybody, are the restaurants meeting the nutrition guidelines?
Yes. For our restaurant model, we took the guidelines out of Chapter 8 and we put it into a template form in Word. And each restaurant had to create, it's a 1-week rotating menu. And it had to meet X amount of servings of this, that, and the other. The portion sizes had to be correct. We used a dietitian to approve those menus, calorie counts, and all that fun stuff. So,
Angela states from Dane that they do make the guidelines and pattern in your restaurant models. So thank you, Angela. Another question, any guidance on how to do the home delivered assessments and reassessments at this time?
Dawn, is that for me? Or are you wondering how that's done in Racine? Anyone?
Anyone?
Okay.
Anyone?
Yeah, I guess that's a good segue to, I wanted to find out about the home delivered meal program and if there's things that you've learned that are making it operate better, and that might have to do with assessments too. How are people still doing them? It sounded like a lot of people went in the direction of telephone, via telephone, which you can continue to do. Is anyone doing anything kind of creative that way or something else? Porch visits. Dawn asked, is anyone doing that sort of a thing?
This is Val from Waushara County. I'm utilizing some of the site managers who don't have as many or any hours that were used to being site managers, and they have been trained to be able to take the registration over the phone. So whenever I get a new home delivered participant, I get that information to those site managers. And then I've also been going through the reassessments that are due and again, feeding those off to the site managers so that they can get some hours. And those are all being done over the phone. Our county is not allowing in-home right now.
Sarah, for a home delivered meal assessment, one thing that we've noticed is, at the very beginning of the pandemic, anyone who needed a meal basically went on home delivered, whether they met the, full eligibility or not. What we are doing now, what our goal is through the month of July, is to take anyone that was put on during COVID and doing a more thorough reassessment of their continued need to be on home delivered meals. Simply because at the beginning, there were no other food resources for older adults. Here in Dane, we've developed volunteer grocery shopping for people. We still transport 1 or 2 people on a bus to a grocery store if they want to go. We're doing food pantry deliveries. And so there are other food access points other than simply home delivered meals. So our case managers are contacting, I know there's probably 250 at least people that were just put on for that purpose. And they are doing the reassessments this month and trying to more in a case management way, link them with food access points that don't involve traditional home delivered meals. And if it's possible to get them off of home delivered meals, if it's safe to do so. We are not doing that in our minority community. We're continuing to deliver meals to that community because we do recognize that our people of color are at higher risk for it. So that's one area we're not touching, but for the most part, we are trying to reel back some of the, not to make it difficult to get food. And if it's still difficult, certainly they have food access issues and they need these meals, but to really take a look at how much they truly need them. It's almost like in the first month, we just threw the kitchen sink at everybody and made sure they had multiple meals a day and they had shelf-stable meals from the national 3,600 we procured. And, and now we're stepping back and going, we could be in this for the long haul. So how do we teach people to gain access to food safely, not necessarily with home delivered meals being the answer? So it's something that we're really focusing on for the month of July so that we can, because our home delivered routes and everything have just exploded. So if we're going to be in this for the long haul, continuing that explosion while we're seeing an increase in home delivered meals simply by virtue of people are aging and we have more people who truly are eligible to not have wait lists and things like that, we're going to have to do a really good job of making sure people know all of their access to food points versus just throwing home delivered meals at them. So just something to think about as you go down the long road.
Right. So you're looking at this from a sustainability standpoint, right? Like it can't continue at this pace. These are questions that we have weekly calls with ACL, and these are questions that come up almost every week is, what are you thinking about related to sustainability? And really the program that is being talked about every time is nutrition. So I guess I'm wondering too, others on the meeting, if you are having similar concerns like Dane with sustainability. Have you had those same sort of explosions in the number of meals and starting to have those conversations or think about that?
Now I'm really grateful Angela brought that up, because that is true about, what we're gonna do. And I was just thinking about maybe that's where we could try to doing the pickup again. We started with that. We didn't have a lot of people, but maybe that's something we could bring back for a while. I don't know how that will go over in the winter, but some people are getting out and about, and we still deliver meals, because in the beginning, everybody was so scared and we wanted to feed people. And maybe that would be a good opportunity. Not necessarily, can you come and pick up your meal then, instead of having us drop it off? Because yeah, our routes are getting longer, and we can't just keep this up. You're right. I think that it needs to be different. We need to start thinking differently. Thank you, Angela, for bringing that up. Yeah.
A couple of chat comments that I think we're back to the home delivered meal assessment reassessment process. Waukesha County staff and volunteers are doing them all over the phone. And then also all assessments are over the phone in Racine. And then Carissa, La Crosse County, yes. I think you might be responding to something different than the home delivered meal assessments. Do you want to clarify that?
I think it was the sustainability.
Okay, great.
Jen.
Carissa.
Carissa, if you're able to, can you unmute and talk a little bit about the concerns and if there's discussions going on in La Crosse about this?
Yeah, so I think the concern in general would be is that we received a lot of great funding, which allowed us to expand, as everyone is talking about here. And it really is just the question of is if that funding would continue or not. And truly, if it doesn't, then again, the sustainability of it is questionable. And at what point do you start scaling back? I do have concerns because ultimately we are projecting that fall and winter will potentially be worse than what it is today. And so it was great that we were able to expand our program. But then again, I think as we're all thinking, if the funding again isn't available or if it looks differently, then how do you really then in a time like that scale back when again the need is going to increase again? So I think it's just that everyone is raising great questions and comments, and it's something that I've been thinking about, especially as we're entering budgeting season, and just knowing that we'll have to make some decisions.
Mm-hmm. Are there programs on the phone that have already burned through their Families First funding and are burning through their CARES, other than Angela? Waukesha too. Yeah, I'm seeing.
One of the concerns that we've been discussing in the region, in the Eagle Country region, is the directive to spend down CARES funding first, because CARES funding is authorized through September of 2021, whereas our OAA funding expires at the end of the year. And I know that they've authorized the Fed portion to be carried over, but the state still hasn't authorized that. That's money that's already been allocated. So it doesn't really make sense to us to not pull down the state and federal funding first and then use the CARES funding when we're done with that, since that has a later expiration date. I don't understand why we're doing it that way.
I can explain that. Well, first of all, it sounds like we can carry our state funding over. That's the latest information we've gotten from the DHS Bureau of Fiscal Services. Putting that aside, what's that?
Carry it over how long?
That's what's unclear at this point. It might only be through the end of the state fiscal year, which is June 30th of next year. So those questions still have to be answered. But it sounds like that state funding can be carried over. But DHS does have rules that federal funding has to be spent first before we can dip into state funding. That's just how it is all the time. They are, they're making this exception for carryover in light of the fact that we have gotten some supplemental funding. The other thing is that the CARES funding and the Families First funding was authorized by ACL for COVID response and recovery. So it has to be used now, while we know that we're in response and recovery. And it is possible, as we've discussed, that we might be in response and recovery for some time. And that's why the funding goes through September 30th, but the intent is that those funds are spent first as emergency supplemental funds. So that's the reasoning. It's not probably the answer that you want to hear, but that's the reasoning behind it.
We
And
just want to,
oh, sorry, go ahead.
funding is just so tight, and we just want to make sure that no money is left on the table because of the parameters that are set on how we can pull down what's available to us. And so seeing that CARES has that longer date, we're like, well, why wouldn't we then pull down what expires first? So thank you for that explanation. We just, like I said, we just don't want to lose any funding.
Sure. Yeah, we don't want you to either. So, yeah, but thank you for asking the question, because it is really tricky with all of these different pots of money. It's really nice to get a lot of funding, but it makes it really complex. So,
Sarah, just a question in the chat room. Families First money needs to be spent before CARES. Is that correct?
Yes, that is the recommendation from ACL and the recommendation from us. There's no actual requirement, although I understand GWAR might have some requirements in place for their agencies just to make it easier on the counties and the tribes and on GWAR to help make sure that those funds are fully utilized, that we don't leave money on the table. So I think there might be more of a requirement at the AAA level for that. This topic, though, leads me to another question that I want to ask quickly, and I know we're getting kind of short on time. One of my concerns is about local funding. I know not all programs get a lot of local funding beyond match, and some don't get any, and it's just in-kind match. Are there any concerns that local funding could be pulled and used for other purposes if your county or tribe is putting in additional funding more than they need to because of the fact that you're getting these supplemental funds? I'm just kind of curious if that's a potential issue.
It is in La Crosse.
Okay.
Like across the board, though, it's not just nutrition, and saying it's across the board with any levy funded programs, but unfortunately of the aging programs, our nutrition program does receive the most amount of levy.
That's the same in Dane. If we don't spend the local levy, it will certainly go to cover another portion of human services budget somewhere. But they won't pull it permanently, and we'll still receive the same amount of levy next year that's in our budget request. So it might temporarily move money to another program, but it won't permanently be shifted there.
I was, we were told that for the 2022 budget year to be prepared for budget cuts based on what the current state of tax revenue looked like in the county. So we're good for this year, but they're already looking, I mean, they've already been asking me program questions. So and the only place that I could cut any tax levy is from the nutrition program. The county, my county matches my nutrition program funding at 120% right now. So I know that they're gonna tell me that I gotta cut somewhere, and I don't even want to start that process again.
Dane put a 5% cut across on the table that we had to present our 2021 with a 5% cut to start. Nutrition does get a lot of the levy, the tax dollars. It is the one program that I did not have to take 5% from. And I think it's because politically they know better than to not feed people. So I have consistently made that case with them that, you know, everything's important, but food is required, you know. So luckily they didn't take the 5, but they are looking, as you said, they're looking at a difficult budget year in 2022. So it could get much worse before it gets better because of the lack of business revenue.
Also, a comment from Richland. Richland has had concerns due to limitations of the program. As far as I'm aware, we are able to still use the levy, but have been told that the budget across the board is tight. Just one last question from the chat room. This one we missed. Has anyone had to entertain the start of a wait list? And I know we're running out of time, but Kim Losey from the ADRC of the Lakeshore was posing that question.
Jean, I'll just add, I hate to keep jumping in here, but Dayton was going to need to entertain a wait list several years ago. Our home delivered meal funding pales in comparison to the need here. At that point, we started using an additional piece to the assessment that a person who's assessed at high risk was then able to receive meals 5 days a week. Persons assessed at moderate risk were 3 to 4 days a week, and persons assessed at low nutrition risk were 1 to 2 meals a week that we could do for them. We have maintained that for 4 years. We do, I would say 2/3 of the people who are on the program now are at high risk, just simply out of attrition. But it has allowed us to not go to a wait list and try and decide who's more at risk or who's more deserving, or first come in, last served, first served. Because I did have to do one of those when I worked in Cleveland, and it's a nightmare to have to make those kind of decisions about who gets food, and somebody basically has to die or go to a nursing home to open up a slot before someone else could get a home delivered meal. So to that extent, we've never gotten to that point. We got close to it, which is why we went with this scaled approach. Of course, a case manager can do the assessment and override that scale for a variety of reasons, that there's information to know that is not, relatively discerned through our nutrition risk assessment that says the person really will need 5. But it does make us then have the discussion with the individual who's assessed about, what their real needs are. Is it a food access issue versus more of a malnutrition issue? Is it so there are tools that are, we would be happy to share. It's a methodology that has really saved us from going in that direction. It doesn't mean we never will have to have a wait list, but it has allowed us to not have one at this point.
There's one more comment back to the funding from Adams County with Donna Richards. We have also been told the same as in Juneau. We may not be able to hire a nutritional coordinator and rework the staff we currently have. Sorry, I just wanted to get those in from people who are calling in.
Yeah, thank you.
You're welcome.
And thanks for the great conversation, everyone, today. I mean, we've covered a lot of ground. So in the interest of time, I'm going to move on to kind of close us out here. We have a few things to go through. GWAR wanted to talk briefly about their process or what they would like to do as far as communication regarding reopening. So is that Pam or Jean, either one of you?
Sure. Thank you, Sarah. So we just wanted to mention today that Pam and I came up with a form that is basically a reopening, kind of a communication form. Obviously, we can't deny or approve it. It's just more of sort of being transparent about a possible opening in one of your congregate sites. So we're going to roll that out. I believe we are done with the form. It could be coming to a dish near you, which will probably be tomorrow since it's the end of the month today. Or look for it in an email directly from the both of us. Basically, it's just some questions, and mostly it's meant for you to, as you're having discussions or talking to your NAC or your board or public health about a possible reopening, it's some questions for you to answer for us to kind of get a good idea, as to what you've done in order to make the reopening safe. So It's not long, it's fairly short. And so if you are having discussions about reopening congregate sites, or you are going to open a site, that form is available for you on the website. We would appreciate it if you would just keep us in the loop and fill that out and send that to whichever one is your GOR representative. Thank
Great.
you.
Thank you. And Jean, just so you don't miss it in the chat, Angela was wondering if you could share that with her.
I sure can, Angela. Thank you.
Great. So I just wanted to, in the last few minutes that we have, first of all, thank you for all of the hard work that you have put in during these last, what are we at, almost 4 months? Yeah, of pandemic response. And I know that it has been challenging. It has been challenging for everyone, but especially for you, because you are providing these essential services to your citizens in your counties and in your tribes. Finally, if you have a couple minutes to hang on, I just wanted to touch on one last point. I would be remiss if I did not say something about the other pandemic and public health crisis that has come to the forefront recently. Though it has been present for hundreds of years and has affected a significant portion of the current older adult population in Wisconsin for their whole lives, the ever-present issues that we've talked about a little bit in the nutrition program of health equity and racism. Our division administrator, or interim division administrator, Stephanie Smiley, shared her thoughts on this topic at a recent division-wide meeting that we had within DHS. And her words were so well stated that I wanted to share some of them with you along with some of my own. So I'll get started. We have a big problem that we need to work to solve. Racism is a public health crisis, and racism is more than an individual issue. When systemic injustices remain, white privilege is fostered. And when individuals and groups point out systemic injustices and inequities, the dominant culture must be made accountable. When we look at disparities, it most often isn't one's race that puts them at risk. It isn't biological. People of color carry a greater burden of health problems from living in disinvested communities and policies aimed at benefiting those who are in power. The Division of Public Health at DHS is an organization that is complicit in the problem because we have not done enough. Racism is a direct threat to public health. There has been much discussion in our division in recent years. We have done all of the listening, and the lack of action is glaring. It's not enough for us to just look at the data and ask why. We know the answer. Our previous division administrator, Jean Ayers, challenged us to think about the policies and ways that our policies disadvantage people who aren't white. I think we're definitely better off having those conversations with her, and I'm grateful that she created space and provided permission for us to dream a bit about a world where we might be able to make real change. However, we need to do more than talk about it, and while we still need to listen, we must listen every step of the way. We have to do, and I want to talk about this in terms of dismantling systemic racism. Health equity is a part of that, but we must get at the root cause if we are going to make a difference. And now some of my own words. Within Bader and myself, I have made a commitment to learn more, as I have realized that there is so much historical context that I have never learned in school or in my personal or professional life. Bader is having conversations almost daily on this topic, and we feel it is critical to ensure that these conversations continue, even though they might be difficult. Fortunately, we've started those conversations recently in the nutrition program among all of you as directors, and introduced the concepts of bias and inclusion to our staff and our volunteers. However, that is just a very tiny step forward. Learning the concepts is important, but we have to figure out what we're going to do next. I have heard from some programs throughout the state in recent years that this is not an issue that they identify with in their communities, because their communities are not racially diverse. First, I want to point out that there are older adults of color in every single Wisconsin county. There are Hispanic older adults in every county. There are Asian older adults in every county. There are Native American older adults in every county, and there are Black older adults in every county. Second, I am now learning that there are reasons that there is little racial diversity in some of Wisconsin's communities. Often because historically there were systems in place to remove people of color, and sadly there are still some systems in place that do this less directly. So therefore, I believe it is my responsibility and all of our responsibility to assess and address the systems that oppress Black and other racial groups through our program and policy change. So today, I hold hope and a commitment to action, and I hope that all of you will help me take action by sharing your thoughts, stories, creative ideas, and suggestions, because I do think there are some things that we can do in the program from a policy standpoint and in other ways to address this. So thank you. Sorry to end on such a serious topic, but I think it's really important. And I want to thank all of you today for joining this meeting. And we will have more conversations about these things going forward. And again, thanks for all that you're doing. And with 4 minutes past, I'll let you get on with your day. So thank you so much to all of you.
Thank you. Nice seeing everybody.
Good call. Thank you.
Thanks, guys.
Thank you.
I'm going to stop the recording. Ready?